Can you address the question of the value of diagnosing acute HCV infection and how to enhance the number of recently infected persons, particularly among the growing number of young people?
So there's great value in diagnosing acute hepatitis C infection. So firstly, hepatitis C, as we've heard about at this meeting, is associated with a lot of things, including transmission risk to other people, as well as the own personal liver disease and 22 years of lost life in Massachusetts. And so it's an infection that we clearly want to prevent, and part of prevention strategies is to understand when people get it in the first place. And that way we can both count the number of infections that are going on and determine the disease burden, as well as tell the patient, you have hepatitis C and you might be infecting other people. And you can also clear hepatitis C on your own or through treatment, and clearance of hepatitis C is also very valuable. So for those reasons, I think the determination of acute hepatitis C is still valuable in today's day and age. You could argue you just wait until they're chronic and treat them then. Well, why wait when you have someone in front of you and you can diagnose acute hepatitis C infection? Now, how to enhance the diagnosis of hepatitis C infection, particularly amongst young people? Well, firstly, you got to ask the right questions. And some of the right questions are what you've been doing lately to place yourself at risk for hepatitis C. And unfortunately, in many parts of our country, we're suffering from a large number of people who are engaged in opiate abuse. And this is highlighted by the recent untimely death of Philip Seymour Hoffman. There have been a series of articles since then describing how young kids are these days getting hooked, first on opiates that are that are prescription medications, and then transitioning to heroin. And so asking kids what they're doing and whether they're engaged in those behaviors would be the right time to then try to diagnose acute hepatitis C in those individuals.